Welcome, everybody, to the Flourishing Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I am here with my good friend, Dr. Phil Richmond. We are talking about the Surgeon General's Framework for Mental Health and Wellbeing in the Workplace that was just released a couple of months ago. And then we get into psychosocial hazards and how to do psychosocial risk assessment and what that looks like. And so a lot of this is about understanding what do our people actually need? And how do we create a workplace that's more supportive of them without making them feel like they're living in danger? And we get into that a lot. And that's kind of a thing for me is I really want to be very supportive of our people, but I don't think it's healthy for us to tell people that their job is grinding them down and that medicine is a toxic place to be. I don't believe that. And I don't think it's healthy to tell people that. And we talk really about what is psychosocial risk assessment and how do you do it in a way that gets results and supports the team without them feeling like they're living in a state of, mental health monitoring. Anyway, it's a great episode. I think you'll enjoy it. I hope you'll enjoy it. Thanks to Dr. Phil Richmond for being here. Let's get into this episode.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast. Dr. Phil Richmond, how are you, my friend?
I'm good, Dr. Andy Roark. How are you, sir?
Doing great. I love getting to talk to you on the podcast. You and I talk on the phone quite a lot.
Oh, we do.
We text, we talk, we are I was going to say incommunicado. That means not communicating.
We're the opposite of incommunicado.
We are mucho comunicado.
Yeah.
You and I. You're one of my favorite people of interest. You're one of my favorite peeps to talk to because you are a thinker and a seeker. You are the founder of Flourishing Phoenix, which is a consultancy that you run. You do a ton of service work in our community around substance abuse, but also mental health and wellness. You're very involved with the Florida Veterinary Medical Association. Mm-hmm. You are speaking nationally and internationally. You've spoken for me at Uncharted Veterinary Conference, things like that. Yeah, you are just generally a person I respect a lot of and who I like to hear your ideas and opinions, which is why I reached out to you when I saw that the Surgeon General had released the Surgeon General's Framework for Mental Health and Wellbeing in the Workplace. This was released just in the last couple of months, and the Surgeon General was laying down mental health wellness in the workplace guidelines. And I wanted to kind of talk them through with you real quick and then sort of start to get a clearer picture of kind of what this looks like in vet medicine, sort of where we are. Is that okay?
Yeah, 100%.
I'll put a link in the show notes to the Surgeon General's framework for people who want to see it. Basically, they've got sort of 5 essentials that the Surgeon General has put forward. The first one is protection from harm, right? Mm-hmm. Prioritizing workplace physical and psychological safety, enabling adequate rest, normalizing and supporting a focus on mental health, operationalize diversity, equity, inclusion, accessibility. That's number 1. Number 2 is connection and community. Create cultures of inclusion and belonging. Cultivate trusted relationships. Number 3 is work-life harmony, right? Provide more autonomy over how work is done. Make schedules flexible and predictable as possible. Increase access to paid leave. Number 4 is mattering at work. So providing a living wage, engaging workers in workplace decisions, building a culture of gratitude and recognition, connecting individual work with organizational mission. And then the last is number 5, opportunities for growth. Offer quality training, education, and mentoring, foster clear, equitable pathways for career advancement, stuff like that.
Yeah.
And my reaction when I saw it was I like a lot of these things. I was a little bit taken aback in that when I look at this, it's presented very much, and then granted, this is for the workplace. I really think that success in wellness has got to be a mixture of workplace initiatives and personal initiatives. Yeah. I think sort of the point I sort of made when I talked to you at the very beginning was, I don't think that it's possible as a business owner, as a workplace, to take an employee who is stressing out all day long and then goes home and drinks a dozen beers and scrolls social media until 4 a.m, sleeps 90 minutes, and then comes back to work. Like, I don't know that we can offer wellness for that person. There's got to be some sort of personal ownership of wellness. But at the same time, I think the idea that we say to our employees, look, you guys need to practice resilience. Now get back in there and get yelled at. That's 100%. Not acceptable. That's not helpful.
Yeah, absolutely. And so let me say this is that we in the United States, we're a smidgen behind everybody else. And I want to say this, I love what the Surgeon General put out, but we are a number of years behind other countries. So a number of years ago, I think it was in 2021, it's kind of like the international OSHA put out the ISO 45003, which is the guidelines for psychological health and safety in workplaces. And so essentially that is that in our workplaces, we need to create an environment that mitigates harm, that protects people from harm, but also promotes flourishing. Like that we have to have those two things. And so I think the Surgeon General's work really highlights that. What it doesn't get into as much, and this is to your point, is that the other aspect of psychological health and safety, workplace well-being, creating a flourishing, positive environment, is that there are three aspects to it. And we like to call it, Dr. Aaron Jardin in Australia, he calls it the me, the we, and the us. So there's an individual responsibility, to your point, a team/leadership level of responsibility, and an organizational level of responsibility. So that, I think, ties everything together with what you're saying, is that it's not enough. I can have all the policies. I can create an environment for team cohesion. My leaders can be positive, individuals. But if I, as an individual, if I have a huge negativity bias and I don't see what I'm bringing to the table, it's not going to work. And then the flip side is that I can have all the skills of resiliency in the world, but if I jokingly say the Dalai Lama went into a veterinary practice and was a veterinarian and had to see 15-minute appointments and was quadruple booked on a Saturday, he might utter the F word. And not all respect to His Holiness, the Dalai Lama, but just saying what resilience can't overcome is huge unachievable job demands. It can't overcome poor leadership. It can't overcome poor change management. It can't overcome some of these things, but we do need all of those in concert to create a flourishing environment.
Where do you see the biggest opportunities in vet medicine? Like when you look at this and you're thinking about the Surgeon General, are there low-hanging fruit that you feel like practices could do a better job of picking up on that just have not gotten the attention that they should have?
Yeah, I think we can take a lot of understanding of what went well and what didn't go so great from human medicine. And that was that resilience, individual well-being apps and well-being interventions focused solely on the individual were pushed on our physician and nursing colleagues from above. It was like, you need to take these resilience classes or else, and what we found, but they didn't do anything to decrease job demands. They didn't do anything to, improve resources. They changed software systems and said, continue the same amount of output, even though we're flipping everything on its head and not accounting for those things. So what we know is that those things are helpful, but I think what we can do is becoming aware of what are called psychosocial factors, psychosocial hazards, these things in the workplace that we know negatively impact workers' mental health. We may not even have them on their radar. So I like to say, Andy, when we're going in, we're taking x-rays on a patient, what's the first thing that we do to our bodies when we're getting ready to take x-rays?
We put our lead aprons on.
Exactly. Why?
Right. So physical safety.
Because we know that machine puts out ionizing radiation. It's damaging to our body. Well, what about things that happen, in the workplace that negatively affect, our mental health? Like sometimes, potentially euthanasia is traumatic situations. Conflict between owners and our staff, interpersonal relationships. Again, we mentioned change management, poor change management, things like that. What are the things that we do as leaders, or what are the things that we do as organizations that we need to be more aware of that negatively impact our workers' mental health, and not put, all the blame on the individual, but that knee-jerk response as a good leader and saying, what part are we playing in this situation if our team's not doing well? And so I think awareness as happens, awareness of these things, awareness of these psychosocial factors is one of the big things I think that we can do in veterinary medicine.
I think we all believe inherently that if you have good leadership, your job is going to be less stressful.
Mm-hmm.
And as you're saying this, I go, okay, I believe that if I have strong hospital leadership, I've got well-trained people, I've got skilled leaders sort of above me, then I am less likely to end up in the situation where I have got this truly irate client who's being abusive to me and things like those things just don't tend to happen. And but it's interesting in my mind, right?
Mm-hmm.
Most of those things are handled. It's kind of this using the Force Jedi approach where it's often subtlety. You build a certain culture. You train people to be able to sort of intervene. You make adjustments when you have problems, which means you have systems to kind of get people where they need to go.
Right.
And oftentimes you have to go through the nasty experience before you go, okay, what are we going to do next time so that doesn't happen? And you just can't anticipate everything that can go wrong.
Right.
But you can respond to what happened and say, how do we prevent this from happening again? But the point, I think, for me is when I think about these things, Phil, they're all really subtle.
Mm-hmm.
There's not, when we put on the lead apron, that's a big, obvious thing.
Mm-hmm.
And AHA or OSHA can come and they can count the number of aprons that we have. And they can say to the staff, do you put this on your body?
Right.
Yes or no? How often? But it's really hard to say, do you support your staff in these potentially emotionally damaging ways? We all have to do euthanasias that are sad, that are upsetting, but we have seen euthanasias go horribly off the rails, and you're like, that never should have happened, and that expectation never should have been set. I don't know how you quantify those things. I don't know how you say, yes, we have not had problems because these things were handled appropriately versus we didn't have these problems because they didn't happen to us. And again, does that make sort of sense about like the difference in something physical that you can see and do versus, hey, we subtly diffuse this, or we reduce the stressfulness from a 9 to a 6. And that's, again, a stressfulness of a 6 is not nothing, but it's something that is manageable for most people again and again, as opposed to the 9 that really grinds people down. And so anyway, when you can't quantify this, Phil, when we're really talking about releasing these pressure valves without drawing a ton of attention to it and without, getting a trophy for making it happen, how do we reinforce this? How do we know if we're in a place that's doing good work?
Well, so therein, you brought up two excellent points. So you threw some numbers out there, a 9 to a 6, is that there are ways that we can quantify those to some degree. What I'll say is in Australia, you said OSHA can come in, there are hazards on the floor. We don't have our spill kit or, those types of things. We can get dinged for it. In Australia, if you have a workforce of over 30, you are mandated to measure psychosocial risks the same way that you are the physical risks in the hospitals. You have to account for those things. And so there are different assessment tools. Those also do need to be followed up by one-on-ones with your team members. One of the things that you said too about the euthanasias, and I mean, we throw euthanasias out there, and I'm not saying that's always, it's always something, to be concerned about. However, what we need to know is what is the frequency? Kind of like seizures, like what's the frequency, what's the duration, and what's the intensity of the exposure of our team to these psychosocial factors. If we're short-staffed one day and we really have to bust butt, that doesn't mean that we're going to smoke the team. Mm-hmm. If we over and over are consistently short-staffed and everything has to come in and we have to see everything, that is then we're increasing those, those unachievable job demands. We're asking more of our team than we should. And we can measure those. And that's the thing, is what gets measured gets managed. And we don't look at these things. Just like we're looking at our patients and taking biochemical profiles and CBCs, we can monitor where we're at. But if we're not doing those things with our teams, what we find is that leadership gap between employee team member experience and how well leaders think they're handling those psychosocial factors in the workplace. Risk, reward and recognition, poor change management, unachievable job demands, job autonomy, those types of buzzwords that we hear. There's almost always a gap in how well I think I'm doing as a leader and how well my team thinks, or the intensity of which my team is experiencing those. And it's eye-opening because we're just, as human beings, we underestimate the bad and overestimate the good sometimes. So it gives us a way to see where we're at too as leaders. Go ahead, Andy.
You think we underestimate the bad and overestimate the good?
Sorry.
Do you think that's true?
As in our performance. In our performance.
When we're thinking about ourselves.
Yes. So
gotcha.
So
okay.
because I tell you what, I get much better, at football in high school the older I get.
Yes.
You know what I mean?
Yeah.
But I mean, just saying though is it's really eye-opening. And these aren't poor leaders that I've seen the data on. These are really conscientious, like great culture leaders that there's still a gap. It's just interesting is all, you get the sign in my office, be curious, not judgmental, but it's just saying, hey, don't beat yourself up. Like, let's see why those gaps are there. And sometimes it is a perception. Sometimes the team, is perceiving a decreased, what's interesting is decreased reward and recognition. But when we look at it, what's interesting is when we do one-on-ones, oftentimes what I'll see is that self-criticism is so high in those individuals, and the team members, that the only way that they have to combat that is for you to keep telling me that I'm doing a good job. And I'm not saying at all that we shouldn't do that with our team members, but sometimes we're depending on external validation to treat the self-criticism. And so that is where some of the individual training and resilience training, like when we talk about growth mindset and self-compassion, and some of these interventions that we'll do in hospitals with veterinary professionals is really impactful.
Well, so how do you collect this information, right? So jumping back to our physical safety metaphor, right? If I walked around every day and I was like, hey, do you feel safe today? Hey, I noticed that you stumbled earlier. Are you sure you're okay? Like if you ask people that every day, I think they'd be like, what? Like, I wonder. So anyway, I've seen presentations where people have literally made the recommendation. We've got this mechanism. And when people clock in, we ask them how they're feeling. And then if they do a euthanasia, the practice management software lets us know, and we'll reach out to them and say, hey, you did a euthanasia today. Are you feeling okay? And I'm like, man, if that messaging continuously flowed in on you of, oh boy, you had a hard day today. Are you doing okay? Are you doing okay? I could see that actually being detrimental because it's continuing. To me, there's this worry of highlighting and overemphasizing the challenging parts of our day. And again, I know I get pushback on this, and I hope people know me well enough to know that I'm not a monster, and I want people to be taken care of. How do we go about gauging our people and how we're doing without it feeling they're continuously being probed for pain, injury, weakness, illness? Because I think that there's real downsides to this messaging that if you're in vet medicine, you're in danger and you live in danger. I don't think that's healthy for us. But I still want that information in that, because I do want to be able to help people who need help and be supportive and make adjustments. And so, Phil, how do I thread that needle of not making my hospital into a sick ward, but still recognizing what's really going on with my people and making the adjustments to make a great workplace?
Yeah. I mean, it's a great point. So, when we run hospital level assessments, we're not doing those weekly, or monthly. Yeah. I mean, we're doing those 2, maybe 3 times a year, like in 3's a lot, if it, it's just, and And what I'll say too is it's really more important as a leader that with the check-in, that it's something where if I'm going through like a checklist, like it's more important that that team member, I'll say it in this way. I mean, and data supports this, but that team member thinks that I have their best interests at heart, and that when I'm and that's why I really, really love the Surgeon General's framework, focuses on those relationships at work, focuses on, mattering at work. Does my leader think that I matter? Because then if that's the case, if we've set that culture and I really am smoked mentally, I can go up to, my leader and feel safe to say, I'm just not off, instead of every time, something happens, that as a leader, I swoop in and say, are you okay? I mean, certainly if something big happens, but let me say this too, is the other thing, and what our data from our assessment shows is that the majority of veterinary professionals are either really doing well, like all, that they're just really, really thriving, or what we like to call, they're living well despite struggle, is that they have the tools like, some days are tough, but I got people that I work with that care about me. I've got some external tool or, some individual tools to help me with that. But I also feel like if I really needed to, like I could go up to my workplace and go, hey, I really need tomorrow off, and that there's no questions asked, but I'm not overdoing it. So that too is, I want to say that is that, the majority of veterinary professionals, when we're in our assessment, which is a little bit different than what the Merck study looks at, but is that the resilience of individuals is, comes through in our data. So,
yeah. Dude, that makes a ton of sense. Tell me a little bit more about the PERMA tool. So you set this thing up, just give me at a high level, give me an overview of kind of how this works.
Yeah, so PERMA is an acronym for positive emotion, engagement, relationships, meaning and purpose, achievement and accomplishment, and health or physical health. And it's a framework that was really put forth by Dr. Martin Seligman, who's the father of modern positive psychology, evidence-based framework. And, it's certainly been, changes with time. But if we have all 6 of those things working well for us, usually we're what we call flourishing, like we're really doing well. But it's like Seligman talks about, there's like dials on on an airplane, is that, we want to kind of use all of them in different ways. We need all of them to get the plane to go, in one direction, or, to fly well. But it gives us an idea of that. And we look at that again, when we look at those individual assessments of those 6 factors, we look at it on an individual basis. How well am I doing those things individually? How well does my team do that? The people that I work with face to face. And then my organization, does my organization allow those things to happen? And that's one section of it. And then we look at some of the nutrients that we know that we need in the workplace. Belonging. Do I have the resources I need? Do I have the autonomy to do what I want? Do I have the confidence and competence, the education? Have I been given the tools to do that, educationally? And then we also look at those psychosocial factors, the OSHA for our brains, I like to call it, is what is the job demand like? What is, when change happens, how well informed am I? Or is it just dropped on me with no regard for how that's going to impact, my stress levels, job autonomy, like we were talking about, traumatic events. Again, job demand, is another big one. And then the biggest one, not surprising given AHA's, what AHA saw, but also what we see in our study is reward and recognition, is how well, not just financially, but how well am I being told that I do a good job. And then the last aspect of the assessment is positive leadership, looking at the compassion of our leaders, the acceptance of different things, the relationship between myself and my team members. Also, do I take responsibility for things as a leader? And what's my emotional wisdom? Like, do I have the ability, do I have the high degree of emotional intelligence as a leader? And those factors, when all of those factors are taken into consideration, it really gives us a really good idea of kind of the health of the practice and culture.
Yeah, that totally makes sense. Phil, I appreciate you coming on and talking to me.
Yeah.
Where can people find you online? Where can they learn more? If they want to reach out about the PERMA tool, where can they get you?
Yeah, at flourishingphoenix.com or flofo.vet. Flourishingphoenix.com is great. Also, we're doing a lot of work with the FVMA. We just launched our Inspire by FVMA program. It's a comprehensive, one-of-its-kind well-being program for state VMAs, a number of pillars, but really works on that red cape, green cape, the lifting people up when they're struggling, access to veterinary informed mental health professionals. And then we're training a cohort of veterinary professionals in these very things on workplace well-being, creating a team that's going to give tools for interventions to improve veterinary workplaces in the state of Florida.
Yeah. Awesome.
Thanks, man.
Awesome. I'll put links in the show note to everything you mentioned. Guys, thanks for being here. Take care of yourselves, everybody. We'll talk to you later.
Thanks, everybody.
And that's what I got. Guys, I hope you enjoyed it. I hope you got something out of it. As I always enjoy these conversations, Phil is such a wealth of information. He is a good friend of mine. I really enjoy talking to him. He's just got such a great insight on the profession overall, but I always take things away from our conversations. I hope you guys are doing great. Take care of yourselves, everybody. I'll talk to you later.